My name's Dr. Chris Arden. I'm GP in Chandler's Ford in Hampshire and cardiovascular lead for West Hampshire Clinical Commissioning Group. What I've got here are two heart valves. One in this hand is a healthy aortic valve. It's got, as you can see, it's got three leaflets which are thin and very, very mobile, so it allows blood to flow out through the heart when it's ejected from the main pumping chamber, which is the left ventricle, into the aorta. What we've got here in contrast is a diseased aortic valve with significant leaflet thickening, which reduces the movement and the mobility of the valves. And as you can appreciate, certainly that restricts flow of blood from the inside of the left ventricle out into the aorta. Patients typically present when they get severe stenosis with symptoms such as breathlessness due to increased strain and workload within the heart trying to pump the blood through these thickened and degenerative valves. Other symptoms may well be chest pain, chest discomfort, and also fatigue and reduced exercise tolerance. So it's very, very important that we detect valve disease early, and often that can be a combination of obviously symptoms and also physical examination and further investigation, including echocardiography as the common test, just to image the valves in more detail and assess if there is any thickening of the valve, what the degree and severity of that is. And we know that patients who do have severe or moderate valve disease do benefit from further evaluation and assessment with a cardiologist with a view to potential intervention, because we know that the long-term outlook for patients with severe aortic stenosis is not good, and we can certainly improve that with intervention, including valve replacement surgery. And that can either be done through sort of conventional routes, but more frequently now can be done through less invasive percutaneous routes that don't involve open cardiac surgery, quick recovery, and often you're out of hospital within 2 or 3 days. So there's lots that can be done for valve disease, and it's very, very important as a clinical community we're alert to that. So if you do have symptoms and signs which may be suggestive of valve disease, in particular aortic stenosis, that you do discuss that with your GP, and then they'll take a history and an examination and obviously refer you on if that's appropriate.